रीड करता ना कोई बात नहीं, इनका छोड़ दो फिर बाद में लिखेंगे, है ना। मेडिकल एंड सर्जिकल हिस्ट्री, ट्रीटमेंट हिस्ट्री, treatment history you can include here, okay, presenting history and treatment history. Then you have to go for the family history. Just make sure with the headings, developmental history. Again we have to discuss it more in depth. That is first antenatal, natal, postnatal, antenatal, postnatal, perinatal, postnatal, this is it, है ना, antenatal, perinatal, and then infant, infantile, infant, then toddlers, then early school age group, early school, then going group, late, then adolescent, then early adult, adolescent, that is pivotal, and young adult, old adult, and geriatric history. Now, make sure with this, what is happening in the antenatal space. Just not take the history about the patients, patients those who are before the childbirth, right? But you have to also include here the details of the mothers, what the habits of the mother is, whether mother is a smoker, alcoholics, okay, and mother having like any
pregnancy hai ya
yes, planned, unplanned, accidental, or sometimes even if you go for the like a segregation with the risk data like a first trimester events and second trimester event and third trimester events.
Infections,
Yeah,
vaccinations,
vaccination.
then proper investigation, ultrasound plan.
That's why I am just making sure that first trimester event and second trimester event and third trimester event, or any events during the delivery, right? During the childbirth. And the third with the perinatal, what about the patient when he is like within 7 days to 0 to 7 days and 7 to 1 month of the time, whether they have like icterus-like symptoms, whether the patient have any cyanotic history, cyanotic SPL is there, okay, even there is septicemia like history, so that these all will improve in this condition, okay. And we have to proceed further whether the icterus, if there is icterus, whether the icterus is physiological icterus, or sometimes it can be shown as a like a pathological one, like a icterus, when the blood serum bilirubin level goes more than 18 and 25. Okay, so that makes a distinction between what is happening in the patient, right? And what about the developmental milestones, whether it's having reached by the appropriate age or not, that is included in infantile history. Okay, and then just after the infantile 1 year to 3 years of age, whether the patient have again with having some more development with the developmental things, that is having like running, walking, making, drawing, okay, circles, cross, etc. And whether the patient is using like 1 foot, 2 foot, both foots while living, while walking and climbing the stairs, and whether the patient, whether the baby can tie their shoes or not, they can put their shoes in appropriate and well side of limbs or legs. So that could also be marked in this total history. And even we have to also focus on the peer interaction while playing the toys to identify earliest as possible. So the things will emerge that whether the patient is able to perform this kind of the things if they at adequate and appropriate age, they may have level with the patient has normally developing child. But once they have delayed or some lag behind, then we can level with the mental retardation and something else. So even any sort of the things which have been left behind could be marked as one of the procedures of the psychiatric illnesses. Now we have to like another is early age group, going age group, whether the patient have like any stranger anxiety or scholastic problems, then have to include it in this study. And even sometimes it's like a puberty or other things which are abnormal growth or abnormal crashes, which are also being included, whether the patient having conduct disorders or antisocial personality or ADHD initially, will found in case they have chances to carry out or carry forward in when the patient grown older, as young adult, old adult as for like adult ADHD or something else. So likewise things, even childhood trauma, because childhood trauma, abuse history, all this makes sense. Okay, so that we have to include in these categories and mention the appropriate age when the patient has had suffering. Likewise, we have to just go for like a little bit more details for the family history, because family history is again is one of the crucial role and crucial part. Because once you trace the pedigree of the patient, you will find that the patient's sufferings in succeeded generation, what kind of the illnesses they have, and then carry out in the later progeny. So here we can mark with this whether this kind of suffering is inheritable or non-inheritable, because many of the time that we studying X being and Y being chromosomal abnormality, autosomal abnormality, that will pass successfully from one generation to another generation. That also will like an impact over the mental illness. So this helps in studying the gene environment interface. Gene environment interface, that is neurodevelopmental models. Neurodevelopmental models. As for example, schizophrenia, we know, and stress diagnosis hypothesis, that is one of the genetic neurodevelopmental model. Okay, because the stressor is there, environmental stressor is there, and having genetic preload sufficient to express the gene, so that it causes schizophrenia in when the patient has crisis.
So sir, ये वाली चीजें mention करनी है.
Yes, of course. You have to mention all the things in this regard, because pedigree is very important, and you can trace how much you can able to trace the pedigree. But at least you must just trace up to 3 generations, because many of us we fail to tell or give details about more than 3 generations. We have a very less knowledge about our forefathers, okay, beyond the grandfathers. So another important thing is what? Is personal history. In general medical history taking classes, we know personal history is very important. We have to find about the routine activity, but here is we have to also know about the habits and personality. Okay, what was the pre-morbid personality of the patient? That is important here. Pre-morbid personality is the patient having like a anxious personality. Okay, but it is not markedly being suffered from like anxiety disorder. If they have, then we can label with this the patient has like an anxiety disorder coming in the next session, and even sometimes they can also develop the maladaptive habits that could be like a substance use, or it could be possibly with some other disorders. It could be a markedly seen in the case of schizophrenia like condition. Okay, because anxiety is one of the predominant symptoms of the schizophrenia or psychosis, where the patient has marked persecutory ideas or persecutory differences. So here we can include all the things, but we have to mark about this person's history, pre-morbid personality, habits, pre-morbid personality. We talk about this, habits of the patient, we can talk about this, and we can also abuse history, abuse of substance. So we clearly define this parameters in the history taking scale. Okay, and side by side you will find out our conclusion that makes a difference, because counseling is not a part of history taking, but beyond that, after finishing the history, we have to start with the counseling, because this gives a what suggestive points, suggestive facts to what the patient has to do. Little makes a difference, because counselor never goes to examination. Okay, but the counselor goes to and remains adherent to their history, and the findings, some makes a positive findings where they need to have correction. Then the counselor will try to approach the patients to correct their facts that emerge after the history. Okay, so that makes a little difference with the psychiatrist and those who have been doing practice of the counseling. Okay? As an example, the patient using alcohols, right? What a counselor does? Counselor stop here, right? At this point.
Counselor.
Yes. Then counselor begins with the wrong, with certain questions. When he started, why he started, how he started, and what he started. Okay, that's always the 5 whys. 5 why questions. Why does he? Why did he start using alcohol? What was the problem at the beginning? What was the mood of the patient? What kind of the liquor that the patient use? How much liquor the patient a patient has to use? Certain questions, and then find out the answer. Okay, if the patient is sadness because of financial crisis, he start counseling on this line. To how to come out from the financial crisis. What could he do? And he can try to understand the social drift hypothesis also. Because alcohol use, if the patient has financial crisis, and because of this financial crisis, the patient got suffering, and he started taking alcohol to get rid from the crisis. Again, the patient loses asset, and because of the losing asset, because of the losing employment, the patient.
It can be secondary, primary to depression or to stress.
Yeah, it could be. Okay. So once we understand this financial crisis is one of the problem to combat with the sadness or depressive moods, and using of alcohol is one of the remedies for getting out from depressive moods. Okay. So here we understand this financial crisis, how make the financial crisis worse after using alcohol. Okay, once he start alcohol using, the patient will develop what? Dependency. The patient has intoxication, and he lose assets because of losing employment, and because of the losing employment, the patient will go again in the crisis and he become poor. Okay, so poor make poorer. Because of this habit. Okay, and this is the hypothesis that we laid for, and this hypothesis is known as social drift hypothesis. Right? Because the patient doesn't have any asset to get treatment for the degradation. He cannot bear the cost of the treatment. So it could be one of the part of the counseling. Counselor will stop here, and then he start trying to check this process of the vicious cycle. Okay? But we have to proceed further. Because we are a psychiatrist, so that we have to proceed further to identify this depression is one of the reasons after examination, right? Not like a counsel. So our part is examination. Since we are the doctor, so that we have to examine the patient thoroughly. Thoroughly means we have to do part following the 2 parts of examination, that is physical part, another part is mental examination part. Okay, physical examination, that means what affects that we have to note it down as the symptoms. Okay, as for example, the patient is alcohol or the patient of the substance use disorder, so that what effect has been made after using of alcohol for a long time over the body of the patient. That makes it granted by the physical examination. Okay, you have to do finding. Our finding will suggestive of what kind of physical suffering make worse to the patient. Right? So after excluding all the things, they have to go for the mental status examination to find the current mental status of the patient and the psychiatric illnesses. Right? So physical examination that we have to, again includes the general examination and systemic examination. Okay? Having the 2 part general examination, that means A to Z. A for appearance, B for build, C for cyanosis, cuvita. Then
Pagal, icteris.
C, D for yes. A for appearance, B for build, C for clubbing, cyanosis, decubitus, edema, then fever, then gait, then hair, then
I say
Icterus.
Then O,
icterus.
D,
O
H,
से
I.
again.
I for icterus, J for jaundice, K for chylonychia, L for limbs, lymphadenopathy, and M for
For
mouth, nose, and oral cavity.
Oral.
M and O. P for again pallor, Q for R for rate rhythm, P for again pulse, then S for skin, T for tongue, then U for uvula, P for vein, any venous prominence of the body, then
W.
W for
Weight.
weight, then X for XYZ.
मतलब any other element.
Yes. Can. Okay. So that we can go for like a to Z examination, right? In the general examination. Another that means some like this follow the same rule of the specific examination. First is what?
CNS.
Systemic. We will study end of this examination. CNS is the end of examination, right? Then here is the chest and CVS. We have certain rule we have to follow. That is what? Inspection. Palpation.
Percussion.
Auscultation. Okay? Palpation and percussion, that is all again like what touch. Inspection, that means you have to examine first by the looking at the systems. Okay? You have to find where what is that in system is what trachea. Okay? Whether it is centrally placed or not. Or deviated somewhere. In case of fibrosis of lung, it is deviated to this side. Opposite side. Or same side.
Sir, क्या sir? अगर
Fibrosis of lung. Fibrosis of
हाँ fibrosis हो जाएगी तो सर same side हो जाएगी क्योंकि उस
same side
का
because
size छोटा हो जाएगा
it pulls the trachea. So the trachea is deviated towards the same side. In case of effusion,
Opposite.
push the trachea on the both sides. Right? Then you have to make the another mediastinum. Is there any bulging over the mediastinum or any part of the chest? What is the place of nipple? Would it be there in at a centrally placed or deviated somewhere? Or in a mid clavicular line in the fifth intercostal space. Find about the apex beat, whether you have to see the hips or apex beats. In case of congestive cardiac failure or any abnormality in cardiac, you can find the parasternal hips. Or pulsation. If you find, can you find any superficial venous involvement that is passing from abdomen to thoracic cavity? That means a worst sign of either cirrhosis of liver or in case of tumor, gastric carcinoma or something else. Aeneas ka symmetry, we noted yesterday how to examine the symmetry.
Yes.
Then palpation. Okay? Palpation means you have to palpate the patient, right? Palpation that includes percussion. What the nodes in each interpersonal speech? Is there any rigidness, dullness, or normal? Movement as well. Bilaterally, equal distance increment by this or not. By pressing the two hands over the case of the chest and bringing the both of the thumbs together and ask the patient to inspire and expire. Whether to see the displacement of the thumb on equal distance on both sides. Right? It could be abnormal seen in case of consolidation. It could be seen like a pleural effusion. It could be seen in fibrosis of the lung. It could also be seen differently in other lung pathology. Okay? So, marked with this palpation, then you have to go for auscultation. Finding with the bronchi, bronchals, bronchial breathings, bronchi, rales, capitation, as well as heart sounds. What about the quality of S1, S2, and whether it is added with the third sounds or fourth sounds, or what is happening with the gallops in case of failures. Okay? So make things very distinct to reaching up to this level. Okay? So I am just stopping here and concluding the topics. Again, we'll have to start take the next from the next day, right? Okay. Today I'm just stopping this class here, and we have to proceed further next day, right? Thank you very much. Just make sure you know all these kind of items to consider while you're recording the history, right?